Okay. So hello everybody, I'm very happy to be here. Fascinating talks till now. My name is Erez Shmueli, I'm a faculty member at Tel Aviv University, and I'm going to talk about self-reported and physiological reactions to the Pfizer booster vaccine. But before I do that, I want to tell you a bit about the pyramid study that we are running for a few years already. It was initiated originally to allow us to provide improved and early diagnosis of respiratory infectious diseases just before the COVID happened. So it was a great validity to what we wanted to do. And basically the project or the study is composed of two main parts. The first part is retrospective. It allows us to receive medical records from two of the largest HMOs in Israel, which are very large also internationally, and a prospective study in which we collect information from several data sources, including sensors from the smartphones, smartwatches that we provide to the participants, and questionnaires. The nice thing about this study is that we're going to have 5,000 participants for a period of 2 years, and those are participants that we work very hard to keep them engaged in the project. We talked, several of the previous speakers talked about how difficult it is to make participants stay for such a long period, and especially when we talk about so many participants. So if you would like to hear more details about it, I will be happy to give it later. And now I want to focus about a specific study that originated from the larger study. And a few months ago in August, Israel decided to give a booster shot of the COVID-19 vaccine, the Pfizer one, basically to the entire population, everyone above the age of 16 who had enough time after the second vaccine. And at that time, at least, and basically also now, the safety of the vaccine was not of the booster vaccine was not established yet. So what we wanted to do is to check the self-reported reactions, but also the physiological ones, as I'll talk about soon. So we had an experiment containing 1,600 participants who received at least one dose of the vaccine, or at least reported it after joining the study. Most of the people in the study received the third vaccine, and as you see, 300 the second and 200 the first. They are not necessarily the same groups because people could join the study at later stages. And we looked at the symptoms for a period of 37 days, starting 7 days before the vaccine. The period of 7 days before the vaccination used as a baseline period. What we see here is a slide or a chart very similar to the one reported in the original Pfizer clinical trial for the first and second dose. And what we see are consistent trends showing that basically what are the most frequent symptoms. Those are self-reported, of course, and who are the percentage of participants who didn't suffer from symptoms at all. And what you see here is that the second and third doses present very similar profile and more frequent symptoms than the first dose, which is, now we know it even better. We also looked at different well-being indicators, including mood, stress, physical activity, and sleep. And again, most of the reactions were in the first 2 days after vaccination, very similar between the second and third dose, much more than the first dose. And this is and most of the reactions disappeared after the third day. This is probably the most interesting slide in this deck, and it shows some physiological measures collected from the smartwatch. In this case, it was a Garmin Vivo Smart 4 smartwatch. The first line above, it's very difficult to see as the text is small. You see a heart rate. The three columns are the first, second, and third dose. And what you see is that most of the change, first of all, there was a great change compared to the baseline in the 38 hours after vaccination. But most of these changes faded away after 72 hours. And you also see that the third and second dose has relatively the same changes, whereas the first one, you barely see any changes. In the second line, you see an additional measure of HRV-based stress that Garmin provides. It's a proprietary measure, but it's based on HRV, and you see more or less the same trend. And in the third line, that's an interesting line, that's SpO2 oxygenation, and what you see is that we don't see any change in the SpO2 in the 3 vaccination doses. Just to say that we also had currently another study in which we looked at the sensitivity of those measures. And for example, we are able to see that even people that do not report any symptoms, self-reported symptoms, we see the same trend in the physiological measures, a bit lower, but still you see the same change, which means that clearly those devices are much more sensitive than the self-reportedness of people. In the last slide, I want to show you is some separation between different subgroups of the population. So what we saw is that for younger people, the effect was higher. That's the first line. And that's true also for the self-reported measures and for the physiological ones. In the bottom one, you see people with previous underlying medical conditions compared to those who didn't. And those who didn't have any underlying medical conditions had higher changes or higher effects, reactions, again, both in the reported and the physiological ones. And in the middle, it's interesting, you see the differences between genders. And what you see on the left is that there is a difference in the self-reported answers or reactions, but we couldn't find it in the physiological ones. It's an interesting question to see further and to see whether there are indeed inherent differences or not. So just to conclude, specifically this study provided us or provide some kind of support for the safety of the booster dose, and particularly for older people and those with underlying medical conditions. They had lower frequency of reactions. And in general, what we would like to see in continuous studies is that wearable sensors can revolutionize in some way clinical trials in general, but also those that are related to vaccinations. They can enable earlier identifications of abnormal reactions with fewer subjects. So that's the vision we see here. I'd be happy to answer questions, if any.